In this video, I'm going to go over burns and skin conditions. That'll be on your final. So let's start with burn type question and answer. Okay, so I'm going to talk about different types of burns here. Electrical burns, what you need to know about them is they cause major damage and they're going to increase the potassium even more so than a burn normally does. So you're going to have to watch for dysrhythmias. Make sure you put your patient on a cardiac telemetry monitor when they come in. Anybody that has been burned in a closed space automatically think inhalation injury. Chemical burns are the burns that need to be irrigated for long periods of time. The most common injury you'll see with burns is a thermal burn injury, and that's like, burning yourself with an iron, that kind of burn. Here, flames, scald, and hot objects are the reason for thermal burns. And chemical burns result with contact from acid and alkali, and you don't need to know what kind of solutions make acid and what make alkali. Electrical burns can cause dysrhythmias up to 24 hours after a burn injury. A patient with electrical burn should be on telemetry, and then they are going to be at risk for kidney injury because when you have an electrical burn, it causes massive trauma inside the body, and myoglobin leaks out of the muscle cells, and that's going to like clog up the kidney, so it could cause an AKI. So with an electrical burn, you have an entrance wound and an exit wound, and they don't look bad. But inside the body, there is massive trauma because of when the electricity flows through the body. I mean, it can break bones. It can break a cervical spine. So electrical injuries are really can do a lot of damage to the body. So a carbon oxyhemoglobin level greater than 10% suggests carbon monoxide poisoning. If you get report that your patient was burned inside, also think about carbon monoxide poisoning. The direct effect of it on the vascular system is going to be vasodilation. So your patient is going to complain of headache. They'll have cherry red lips and skin. You'll see cherry red skin. It's treated by giving 100% O2. ABGs are not going to be reliable with carbon monoxide poisoning because carbon monoxide has a higher affinity for the red blood cell than oxygen. So in other words, carbon monoxide is going to kick oxygen off the red blood cell, and carbon monoxide is going to take its place. But it's going to be read the same on like your O2 sat monitor, so that all is going to be unreliable. Carbon monoxide impairs the consumption of O2 to tissues, which is true. There are 3 types of smoke inhalation injury. Metabolic asphyxiation, which is carbon monoxide poisoning, and then you have your upper airway injury and your lower airway injury. Carbon monoxide poisoning results in cherry red lips, and carbon monoxide is a vasodilator, so your patients are going to complain of headache. If your patient becomes confused, think carbon monoxide poisoning. That's what you should suspect. The treatment for carbon monoxide poisoning is 100% O2. Patients who do have inhalation injuries are going to be prophylactically intubated before they start having edema of the airway. They could have hoarse voice. They could have carbaceous sputum, which is black sputum. They could have blisters and edema in their mouth and nose. They could have singed facial hair. So watch out for those kinds of signs and symptoms in patients with a burn injury. Okay, now I'll go into burns and give you some tips about burns because there's quite, I think there's like 25 questions about burns on the exam. So burns are categorized by their depth, and we'll go into length about that. Total body surface area, and you're going to need to know the rule of nines. In your resources for week 12, there's 2 quizzes you can do for rule of nines. Get that locked down. The severity and like risk factors to the client. Okay. Superficial is what we formerly called first degree burns, and you're going to have to know these characteristics. because you'll get questions that'll either describe these characteristics and it'll say, what type of burn do you suspect? Or it'll say, the person had this type of burn. What kind of signs and symptoms are you going to see? Okay. So superficial is like, an example is like a sunburn or somebody that's been laying on like a heating pad or somebody using an aquathermic heating pad, which is why we don't like people using heating pads. The color is going to be pink to red. The other name for red is erythema. Remember that. It does blanch. Edema is mild. They're going to have pain. So the more superficial, or I should say, the higher the burn in the skin, the more pain they're going to have. Because as it goes lower, they're going to lose their nerve endings and they're not going to feel the pain. No eschar. Healing time is quick, quick, quick. Okay? And there's an example of it. Second degree burns include superficial partial thickness and deep partial thickness. Okay? Now, with superficial partial thickness, the color is going to be pink to red. It still blanches. It's going to be moist. The edema is going to be mild to moderate. They are going to have a lot of pain. No eschar, no grafts needed. And with superficial partial thickness, they're going to have blisters. Once you hear that a burn has blisters, you know it's a second degree burn because they're the only kind of burns that have blisters, and most of them are going to be superficial partial thickness. So they're going to have the blisters. With deep partial thickness, the color white shows up. It's going to be slower to blanch and it'll have a decreased capillary refill if it's like on a limb, right? Edema is going to be moderate. They're still going to have pain, but it's going to be less so than superficial partial thickness. Rare blisters. Eschar is going to be soft and dry. They're probably not going to need grafts. If there's still a dermal layer, some of the dermis in the burn, that can regenerate itself. With full thickness burns, okay, the color is now, I call the rainbow, a lot of different colors. Black, brown, yellow, white, red, waxy, and charred. Edema is severe. They are not going to have pain within the wound bed, but they will have pain around the edges, so you still have to medicate your patients. Okay, no blisters. They have hard, inelastic leather eschar. And how I remember that is the full thickness, there's L's in the full thickness, and there's leather begins with the letter L. So leather eschar shows up in full thickness burns and deep full thickness. Long time to heal. They're going to need grafts because the dermal layer is burned off. Okay, so in this layer, the sweat glands are destroyed, decreasing excretory ability. And then with deep full thickness, also in full thickness, the nerve endings are gone, so that's why they don't feel the pain. In deep full thickness, the color is black. Edema is absent, pain is absent. They will have pain around the edges. No blisters, hard inelastic leather. Takes a long time. And then this layer damages the epidermis, the dermis, the fascia, and the tissue. So that's important to know because it goes through all levels of the skin. You're going to be down to the bone, tendons and bone. Which complication can result from a circumferential full thickness burn to a limb? Compartment syndrome, because as the leather gets really hard and it's inelastic. So make sure you know the signs and symptoms of compartment syndrome. You learn them in Med Surg 1. Remember, the hallmark sign is pain despite getting opioids, and then check for your 6 Ps. Okay, now the treatment, if somebody does have a circumferential injury, is a fasciotomy. The surgeon needs to be called and they're going to have to come in and do this right away. Okay, and then if somebody has a circumferential burn on their chest or thorax, you're worried about decreased chest excursion due to the leathery eschar. So the treatment for that is going to be an escharotomy, and this is done right at bedside. And this is for full thickness and deep full thickness burns. The physician's going to make these hash marks on the skin, so now they'll be able to breathe. So you'll be watching out for that. How is total body surface area estimated in the rule of nines? So in the rule of nines, okay, you need to know all these denominations. So the total head and neck is 4.5. Okay, sorry, is 9. The anterior is 4.5. The posterior is 4.5. If it just says head, give it 4.5. It may say head and neck. That's still 4.5 for one side. The torso, okay, is 18%. So you can break it up into 9 on upper and 9 lower, and so that would be for front and back. So if the front and back of the torso was burned, that would be 36% because the whole thing is 18%. Genitalia is 1%. Each arm is 9%, 4.5 on each side. Each leg is 18%, which is 9% on each side. So if it just says a leg, that's going to be 18% if it doesn't differentiate between anterior and posterior. Okay, so there are 2 quizzes located in your resources a week 12. I suggest you really go in and practice, okay? And it's really easy to forget something. So make sure on your sheet of paper, you are going to write out each area and assign the number to it so you can add it up correctly, okay? Which patients are high risk due to past medical history? Older adults and people with history of a cardiac condition, because one of your primary goals when somebody comes in with a burn injury is they're going to get a lot of fluids, okay, because they can die from hypovolemic shock. So if they have CHF, it might be a problem. So that's why you need to know that. You're going to give the tetanus vaccine for people that come into the ED with burns after you take care of airway, breathing, circulation, disposition, and exposure. Okay, so it's like not right away, but you are going to give it. It's really important. Okay, burn prevention education. Okay, don't smoke in bed. Don't smoke near oxygen. Use fire and carbon monoxide detectors. Your water heater should be set on 120 degrees. Sunscreen and protective clothing is needed when you're outside in the sun. Use pot holders. Don't overload your electrical outlets, which is what everybody's doing these days. All right, there are 4 stages of burn management. The pre-hospital stage, the emergent stage, which is also called the resuscitation stage, the acute stage, and the rehabilitation stage. So first aid for minor wounds, burns, includes running cool tap water over the burn continuously for 10 to 15 minutes. Now, if it's a small burn, you can do 10 to 15 minutes. If it's a large burn, you don't want to irrigate longer than 10 minutes. And the reason is your patient's going to get hypothermic. Remember that the skin protects us and helps us maintain our body temperature. You're going to apply cool compress if continuous water flow is not available, but that's not the preferred method. Don't apply ice, water, butter, or ointments, and don't pop blisters. Cover loosely with a sterile gauze bandage. Take ibuprofen or acetaminophen for the pain. All right, so that's really important. Pre-hospital care. You're going to remove them from the source, cool within 1 minute with tap water, no butter or oils, and do not ever submerge a patient in cold water or put on a cooling blanket for somebody with a burn because you don't want them to get hypothermic. Keep them NPO. Patients with burns are going to could have paralytic ileus because the body's under so much stress, right? It's got to save its energy for like the hearts and kidneys. So the gut may not be working. All right, the emergent phase. It starts at the start of injury and goes for about 24 to 48 hours. There's going to be massive capillary permeability because when somebody has a burn, there are local changes that happen, but there's also a systemic change in the body. The body undergoes a massive inflammatory response, so they're under a lot of stress. So what happens when there's leaky capillaries is all the fluid is going to leak out of the capillaries, and the patient's going to be massively edematous. But the problem is there's no fluid in the vascular space. That's why we give massive amounts of fluid in the resuscitation phase. So one of your goals when the patient comes in is to get 2 large bore IVs inserted so that you can initiate the IV fluids on arrival to the hospital. You got to start them right away. The solution that is used is lactated ringers because it's most like plasma. I told you about inserting the IVs. Tetanus toxoid is given after A, B, C, D, E, but it is given. The labs you're going to expect. Okay, so with capillary leak syndrome, albumin is going to be able to seep out of the capillaries. Water is going to follow, and sodium follows water. So you're going to have a low albumin, low sodium, high specific gravity. Because the the vascular volume, is hemoconcentrated, you'll have a high hematocrit. Hyperkalemia is going to be seen because there's massive destruction of cells. And when the cells are damaged, they release potassium. So why do we give patients massive amounts of fluids? It's to prevent hypovolemic shock. And which parameters should the nurse monitor to determine the effectiveness of fluid resuscitation? The urine output. Your goal is a 0.5 milliliters per kilogram per hour of urine output. Now, patients that have burn injuries, significant burn injuries, are going to be at risk for Curling's ulcer. It'll develop 24 hours after the burn injury, and that's a stress report. That's a stress ulcer, and that's they're going to need to be put on GI prophylaxis for that, so like a PPI or an H2 antagonist. The glucose level is going to increase due to stress, even in non-diabetics. They're going to be in a hypermetabolic state, which means they're going to have a low-grade temperature for weeks. But it also means they're going to be at risk for poor wound healing, and they need a high-calorie diet. They can burn like 5,000 calories a day doing nothing because of the wound, okay? They need high protein because that helps you heal. There are 3 types of inhalation injuries. Metabolic asphyxiation, which is carbon monoxide poisoning in upper and lower airways. With carbon monoxide poisoning, the signs and symptoms are cherry red lips and skin, confusion, headache, dizziness, dyspnea, normal ABGs and O2 sap. That's unreliable. I talked about that in another Quizlet. The carboxyhemoglobin level is going to be greater than 10%. So this is what you might see if you see cherry red right here, and the lips would be cherry red. All right, the treatment is going to be 100% oxygen. They can also do hyperbaric oxygen therapy, but that's not readily available, so 100% oxygen. Anybody that has facial burns, you need to look for airway injuries. The signs and symptoms of airway injury include blisters in the mouth, hoarseness, stridor, singed nasal and facial hair, and the carbaceous black sputum. Now, the acute phase of burns begins with the mobilization of the extracellular fluid, so the capillaries get better, the fluid moves back into the vascular space, and then the patient starts diuresing. And it finishes, the acute phase finishes when the skin is completely covered by skin grafts or when the wounds are healed. So the main goal in the acute phase is to prevent infection. There's 2 terms you need to know: autocontamination, which means the patient's at risk for infection due to normal flora that overgrows and penetrates the internal environment. So your nursing intervention for that is to make sure you're changing your gloves for different areas of the body and between old and new dressings to prevent auto-contamination. And then cross-contamination is when bacteria and microorganisms are unintentionally transferred from one substance to another. So an example like this is like bringing a Dynamat room to room, okay? You don't want to do that and burn patients because they're more likely to get infection. So all their equipment should be in the room. Everybody should be, practicing really good hand hygiene, and no sharing of equipment. We don't allow fresh flowers in the room to prevent Pseudomonas infection. Pseudomonas is a water bug, so you never want standing water laying around. Physical therapy begins in this stage. Hydrotherapy begins in this stage. Hydrotherapy is an example of mechanical debridement. Okay, when somebody has eschar, so for like the full thickness and the deep full thickness, the eschar has to be removed before the wound can start to heal or before they can put even grafts on, because at that level the skin is not going to regenerate itself. Okay, they're going to need grafting. So they may use topical enzymes also. That's used for burn injuries. So sulfosulfidine or Silvadine, if you ever used that before, can be put on. It can be painful. So if you're going to use one of these debridement ointments, you need to make sure your patient is medicated. With Silvadine, the side effect is neutropenia. With mafenite acetate, the side effect is metabolic acidosis. And then the rehabilitation phase of burn injury begins with wound closure and ends when the patient returns to the highest level of functioning. So it could take to the rest of their life. And the focus now shifts to psychosocial adjustment and prevention of scars and contractions. So the treatment to prevent hypertrophic scarring is pressure garments. And here's like a little picture to show you, and there's some good pictures in your book. And they may have to wear these up to 23 hours a day, and they can be quite uncomfortable. So anyways, that is burns. And then the next Quizlet I'm going to go over is skin conditions. Now, I'm hoping that you've had some of these before. You're going to have to know the stages of pressure ulcers. Sorry, okay. The new term instead of pressure ulcers is supposed to be pressure injuries, but I have obviously reverted back to pressure ulcers here. So, the risk factors, I think you know, people that are immobile, decreased LOC, anybody malnourished, so like with a low prealbumin level, anybody with incontinence, shearing injuries. Shearing injuries happen when you don't lift a patient to move them up in the bed. Like you just, pull their body up. Don't do that. Okay. To prevent them, you want all surfaces to be smooth, like in their bed. Okay. You want the patient to keep moving, so make sure you're turning them. Incontinence management, don't let your patients sit in urine and feces. They need to be cleaned up right away. And good nutrition, so protein and vitamin C helps with collagen synthesis, so it's good for the skin. You want to turn your patients Q1 to 2 hours. Do not slide in the bed. You must lift them. Use positioning devices if your institution has them. Make sure you clean skin with warm water and mild soap and then apply moisturizer after cleaning. Not between the toes, of course. Wheelchair users should shift weight every hour, but even every 15 minutes is better. No donuts. A donut is like a foam pillow that we used to use for patients in wheelchairs. We don't use that anymore because what we've ended up doing was just giving them a pressure ulcer higher up on their sacrum. So just don't do that anymore. Okay, never massage bony prominences because it impedes the blood flow, and encourage the use of a trapeze. We always like patients to be independent if they can. So nutrition for pressure ulcers, I mentioned high protein and vitamin C, but also zinc, vitamin A, and E. Okay, so with these stages I'm going to present, you are going to need to know the characteristics of them, okay? So stage one, this is the skin is still intact, but it's red and deep pink or mottled, and it does not blanch, okay? Stage two pressure injury, now we're going to partial thickness, so they're going to have pain, involves the dermis and the epidermis. I'm sorry, it involves the epidermis and possibly the dermis. The skin is going to be blistered or abraded or have a shallow crater. Okay, so stage three pressure injury is a full thickness tissue loss with visible fat. Okay, the skin is ulcerated and there's a crater-like ulcer. Bacterial infection is almost always present at this stage. And with stage four, it's a full thickness loss, but the bone, muscle, or tendon is exposed. They could also have a dry black ulcer or eschar. Okay, then I have a whole bunch of questions here that you can go and practice, like which type of pressure injury has a crater, like ulcer, and that's stage 3. Okay, so go in and do this Quizlet. Undermining of a wound happens in stage 3, and this is undermining. It's like, see, the skin is here, and this is, right here is undermining. Okay, that's what that is. Okay, so what you're going to do if you discover a new ulcer, first position the client off the ulcer, right? And then you're going to need to measure it and document it, and then keep doing that at least 1 time per week. Now, you may be doing treatments and still documenting on the treatments that you're doing for that ulcer every day, but the whole measurement needs to be done once a week. And you should never massage a bony prominence because it decreases blood flow to that area. All right, so make sure you go in and do this Quizlet because it has a lot of good information in it. So, herpes 1 simplex is oral, like cold sores or blisters. It could be in their nose. And herpes 2 simplex is lesions in the genital area from herpes virus. Okay, but somebody with type 1 lesions can end up with type 1 lesions on their genitals if they're not careful, like they touch their lips and touch the herpes 1 simplex and then use the restroom without washing their hands, okay? They could develop herpes 1 simplex on their genitals, okay? How is it reactivated? Herpes, it's reactivated by stress, UV light, fever, any kind of skin irritation, and fatigue. Now, the other type of herpes is herpes zoster, which is shingles. It involves a painful, blistering rash accompanied by, general feelings of unwellness. Now, this is what it looks like. It follows the nerve endings because it lays dormant. It's the chickenpox virus, varicella, that lays dormant in our nerves. And then when we get under stress or we're immunosuppressed, shingles are going to come out, and it's quite painful. Severe pain, and it follows along a nerve pathway, so it's going to be like in this kind of shape, and it's only on one side of the body, so that's like a tip off too. Okay, so it's reactivated by malignancy, radiation, stress, and trauma. The patient is going to have blisters on one side of the body. It follows the nerve pathway, I remember that, and then they're going to have severe pain. The type of precautions they need are airborne and contact. All right, the treatment includes analgesics, antivirals, and corticosteroid POs. Okay, so if your patient has herpes shingles, you're going to monitor for post-herpetic neuralgia. It's a really common complication. It's extremely painful, and older people are going to be really at risk, okay? And it causes pain and sensitivity to touch. So the treatment for it is usually a lot of different meds, but they can use like gabapentin and oral corticosteroids. And remember, with oral corticosteroids, that it's going to increase the glucose level, which can also lead to infection because bacteria love sugar. Okay, now we're going to move into skin cancer, and basically your risk factors for skin cancer include having a sunburn as a child, repeated sunburns, people with fair skin, so light complexion, blue-eyed, red, or blonde hair are going to be more at risk in spending time in the sun. Basal cell carcinoma is a skin cancer in the basal level of the epidermis. It's very common. It's caused by sun exposure. It doesn't metastasize, and usually has a good prognosis if it's found early. The thing is, if it can go like years. If it's not treated, it can grow down into the other areas of the body, depending on where it is, because this could also be on the trunk, okay? So the patient could die from the invasion of underlying tissue, so that's why it needs to be discovered early. And then with squamous cell carcinoma, this does metastasize. It appears on the head and neck, and it's due to exposure to sun. Um, and so that needs to be removed. They all need to be excised early. With melanoma, there's too much exposure to UV light usually, and moles change, and it's people with fair skin, freckling, and anybody that has a history of immunosuppressant treatment. So the moles can change color. It can look like a blackberry. So make sure you especially know who's at risk. Um, and also these stages are really important for you to know. And I think you're probably pretty good on how to prevent and what to do with pressure injuries.